Hi, my name is Kaushik Das, and I'm an advanced endoscopist at Washington University in St. Louis and a member of the AGA Clinical Practice Updates Committee. I had the privilege of working with my colleagues, Dr. Marvin Ryu from Brigham and Women's Hospital in Boston, Dr. John DeWitt from Indiana University, and Dr. Vanessa Shammy from the University of Virginia Medical Center on this clinical practice update commentary on interventional EUS for vascular investigation and therapy. While the first EUS guided vascular intervention was reported over 20 years ago with sclerotherapy of esophageal varices, a wide array of interventions have entered more routine clinical practice in many large centers, including gastric variceal therapy and portosystemic pressure gradient or PPG measurements. Emerging interventions such as the treatment of ectopic and rectal varices, splenic artery embolization, therapy of arterial bleeding, including pseudoaneurysms, and portal venous sampling have also been reported in smaller series. This review critically evaluates the evidence for these interventions, examines opportunities for future research, and identifies those clinical scenarios where EUS-directed therapy may have particular advantage. While these modalities are safe and effective in well-trained hands, data have been limited to uncontrolled case series and small comparative studies. Thus, these procedures may be best executed in experienced referral centers where the management of these patients can be coordinated by a multidisciplinary team of hepatology, transplant hepatology, hepatobiliary surgery, interventional radiology, and therapeutic endoscopy, taking into account available therapies and local expertise. While larger comparative studies are required to delineate the role of, for example, EUS-guided gastric variceal embolization in the treatment algorithm, particularly relative to IR endovascular therapies, we review strong data supporting safety, efficacy, and durability of this approach in the management of these difficult patients. EUS PPG measurements have been shown to have excellent correlation to hepatic fibrosis stage and clinical portal hypertension and has its strongest use case when there is another indication for endoscopy, such as variceal screening or liver biopsy. We hope that this clinical practice update will stimulate future research that will further redefine and standardize the emerging role of EUS in the management of vascular lesions. To learn more, please read Interventional EUS for Vascular Investigation and Therapy, which can be found in the July issue of Clinical Gastroenterology and Hepatology.